So a very important part of the skeletal system is going to be bone growth and homeostasis. Cells that are involved in bone growth, remodeling, and repair would be our osteoblasts, osteocytes, and osteoclasts. The osteoblasts are going to be our bone-forming cells. They're going to be responsible for secreting the organic matrix of bone and help promote the deposition of calcium salts into that matrix. Now the osteocytes, this is what we call our bone cells that have matured. When the osteoblast surrounds themselves with a calcified matrix, they become osteocytes within the lacunae, which we described earlier when we were talking about the structure of a bone. Now, osteoclasts also play a very important role in bone remodeling. These are going to be bone absorbing cells. They're going to help break down those bone cells. They're going to return that calcium and phosphate into the bloodstream. Now, throughout your life, osteoclasts are going to be responsible for removing the matrix of bone, and osteoblasts are going to be responsible for building it back up. Ossification is the process of the formation of bone. Bones that form during the embryonic development in two distinctive ways. There's intramembranous ossification and endochondral ossification. Now, intramembranous ossification forms those flat bones, so like the bones of your skull. The bones are going to develop between sheets of fibrous connective tissue. Osteoblasts in the periosteum are going to carry out further ossification throughout the course of development. Trabeculae form are going to help fuse into compact bone, which is going to surround the spongy bone that's found inside. With endochondral ossification, this is going to be what's responsible for forming most of our bones, or our long bones like the tibia. Calcified bone matrix is going to slowly replace the hyaline cartilage models of the bone. So when you're first developing the fetal stage, the entire skeleton will be made out of cartilage, hyaline cartilage. Slowly over time, that is going to be replaced with that calcified bone matrix. Bone formation is going to spread from the center of bone to the ends. So we're going to start off with a hyaline cartilage model, and it's going to slowly undergo that ossification process, and it's going to be replaced with actual osteons and osteocytes over the course of time. So if we're going to increase bone length, the increase in bone length is going to occur right up here near the epiphyseal growth plate. So the layer nearest the epiphysis is going to be the resting zone. So that's going to be this region right up here. This is where cartilage is going to remain. But the next layer down from that is going to be, so that's this resting zone right up in here. The next layer down from that will be the proliferating zone, in which the chondrocytes are going to be producing new cartilage cells. So we're going to be producing more and more cartilage in this area, but as we move down from that, we're going to reach the degenerating zone. This is where the cartilage cells are dying off, and they're slowly starting to ossify in the ossification zone. This is where bone is forming, which is ultimately going to increase the length of the bone. So the major growth of the bone is going to be happening right here in this area. This is going to be the region where the bone is extending and lengthening. So the final size of the bones, this is going to be determined by a couple of different hormones. When the epiphyseal plate closes, the bone lengthening can no longer occur. And there are going to be a lot of different hormones that are going to play a very important part in determining this bone length. So for example, vitamin D, this is going to be formed when the skin is exposed to sunlight. It's going to be converted into a hormone that is necessary for the absorption of calcium from food. So low vitamin D levels in children can cause rickets or bone deformities, including bowing of the long bones. Growth hormone also plays a very important role. It's going to be responsible for stimulating bone growth. Now, in order for this to occur, you need concurrent action of the thyroid hormone to stimulate metabolism. Dwarfism is caused by too little growth hormone in childhood. Gigantism is caused by an excess growth hormone in childhood. In this case, we're going to see extremely long bones. So in the case of gigantism, too much growth hormone in childhood when the child is still developing, we're going to see very, very long bones, very, very tall children. Acromegaly is going to be excess growth hormone in adults. Now, because of this excess growth hormone occurring at the adult stage, the epiphyseal plate has already closed. The bones are not going to continue to lengthen. However, they will continue to thicken. So we will see that in the case of acromegaly, we're going to see excessive growth of the bones in the hands and the face, and we're going to see a thickening of those bones especially. Sex hormones also do play an important role. They're going to be responsible for increasing growth during adolescence. So I do want to talk just briefly about maintaining calcium homeostasis and our bone remodeling. Bone remodeling is used or occurs when the osteoclasts break down the bone and the osteoplasts build it back up. Now, this is going to be responsible for recycling about 18% of our bones each year. Paget's disease is caused by when new bone is generated at a faster than normal rate. Unfortunately, this doesn't give the bones enough time to ossify, so it produces softer and weaker bones, which can cause pain, deformities, and fractures. In order to maintain our calcium homeostasis in our blood, we're going to use some of the excess calcium stored in our skeletal system to help maintain our blood calcium levels. If the blood calcium rises, some of the excess is going to be then deposited into the bones. If blood calcium drops, the calcium is going to be removed from the bones to bring it back up to normal. Now, this is going to be regulated by several different hormones, specifically parathyroid hormone, so PTH. This is going to stimulate the osteoclast to dissolve bone. So when we have when our blood calcium levels drop, the osteoclasts are going to be, the parathyroid hormone is going to be released. This is going to stimulate those osteoclasts to start breaking down that bone and releasing that calcium into the bloodstream. This is going to promote calcium absorption in the small intestine and kidney and help increase our blood calcium levels. Vitamin D is needed for the absorption of calcium from the digestive tract into the bloodstream, so it can then be deposited into our bones. Calcitonin has the opposite effect as PTH. So whereas PTH breaks down and releases calcium from the bones, calcitonin builds up those bones and absorbs calcium out of the bloodstream. Estrogen can also play an important role. It increases the number of osteoblasts. So it doesn't necessarily stimulate their function, but it does increase their number. The reduction of estrogen in older women can cause osteoporosis. That bone is not being built up as quickly as it's being broken down, and it can lead to a porous structure of the bone. So here is a little bit of what that osteoporosis can look like. The bones can become weakened due to a decreased bone mass. The skeletal mass increases until around age 30, but then after that, there should be roughly an equal rate of formation and breakdown of bone mass until you reach around age 50. At that point, reabsorption begins to exceed formation. So the total bone mass will slowly decrease with time. There are certain risk factors that make you more prone to osteoporosis, things like gender, so it is much more common in women. Those individuals who are thin or have a family history of osteoporosis, early menopause, smoking, diets low in calcium, excessive caffeine or alcohol consumption can all lead, or a sedentary lifestyle can all lead to an increased risk for osteoporosis. All right, so the last part that we want to really talk about in this section is going to be bone repair. What can we do when the bone breaks under sort of normal conditions? How does the body repair itself? So there are going to be several steps to bone repair. The very first is going to be the formation of a hematoma. A hematoma typically forms within a few hours after the fracture. This is a blood clot that forms between the broken bones, so it'll form right in between the break. After a while, it's going to be replaced by a fibrocartilaginous callus. This takes around 3 weeks to form. This is going to form in that area where the blood clot was. It's going to slowly replace that blood clot. Then this is ultimately going to be replaced by a bony callus that forms in about 3 to 4 months. Cartilaginous, this is where that cartilaginous callus turns into bone, and then after time, remodeling will occur, where the osteoblasts will build new compact bone at the periphery. Osteoclasts will absorb that spongy bone, creating a new medullary cavity. And here's what that looks like. So here's our original hematoma. That's going to be the blood clot. Now, this forms very quickly. This is why bones heal so quickly on their own. Within 3 hours, this sort of gap has already been repaired, and we've able to sort of start the blood flow again. That fibrocartilaginous callus that forms shortly thereafter is going to allow for the blood vessels to start to reconnect, feed that area, nourish that area, and allow for stabilization of that bone. The bony callus will eventually fill in that matrix, and after a good amount of time, remodeling will occur, where that bone will become seamless once again. There are a couple of different types of bone fractures, and the type of fracture can determine the repair, the amount of time that it takes to repair, and then the end result of that repair. So a complete bone fracture is when the bone is broken clear through, like we saw in this previous photo, where we have severed the bone completely. An incomplete bone fracture is when the bone is not really separated into 2 parts. The bone might be split only halfway. A simple fracture is when it does not pierce the skin. So the bone breaks, but no skin is broken. The bone remains inside the body. Now, this, of course, is great because it does significantly reduce the risk of infection if the skin is not broken. A compound fracture does pierce through the skin. So not only is the bone broken, but it pierces through the skin, exposing it to the air, and of course, increasing our risk for infection. An impacted bone fracture is when the broken ends are wedged into each other. So this would be if these two, if the bone was severed and then driven into itself, is when we have an impacted fracture. A spiral fracture is when the break is ragged due to a twisting of the bone. So if the bone were to be actually twisted, we would see sort of a jagged appearance in this bone. It can be very difficult to repair. All right, so you should be able to describe how bone growth occurs during development and summarize the stages of bone repair. You should also explain the significance of the skeletal system and how it is involved in maintaining that calcium homeostasis.